Okay, welcome everyone. Dr. Ovo here. Welcome to Family Health, episode 2 on my family companion. I'm excited to welcome every single person. I don't know where you're joining in from, all right, but I'd like you to just get to the chat room in the comment section and just drop your location. I want to know where you're coming in from. I may not be able to recognize every single person, but just want you to know that I'm glad that you are here. But my special appreciation goes to Medical Women's Association of Nigeria, the Outreach Committee, and the work we are doing together to spread this news around the nation and beyond. Okay, this is the time for you to begin to make sure that everyone you invited to be on this call is present. We're going to be looking into a lot of interesting issues. We're starting with the story of a woman who lost her twin pregnancy after 2 years of waiting because she was treating malaria, not knowing she was pregnant. We're going to look into how you know those things that happen in the early stages of pregnancy. We're also going to be looking into how to know your fertile window. Some people don't know when their ovulation comes. If a woman and a man, especially people who live apart, or the man travels a lot and they keep having intercourse for even several years, they may not even be able to have children simply because they don't understand the fertile window. And this is part of the challenge that people face. I'm going to help you to, in fact, I'm going to be giving this book for free, the family companion for free, to someone who gets to answer the question correctly at the end of this session. And I will teach you how to use mathematics, simple mathematics, 1 + 2, to identify your specific days of ovulation. And that is a period you're supposed to have sex to have babies. And of course, that's also the period you're supposed to not to have sex if you don't want to have a baby, especially if you are not married and you're sexually active. This is very important knowledge for you. So, yeah, this is not a religious platform, so I don't want to preach, okay? So whether I will tell you not to have sex or have sex, some people will go ahead and have it, okay? So we'll be talking on, looking into your fertile window and also your safe period, which is the period you can have sex, unprotected sex, and then the chances of pregnancy are very slim. Then we'll look into how treating malaria could result to miscarriage, even stillbirth, and other more severe complications, and so many other things. And at the end of the video, we're going to list all those drugs you are supposed to know that you're not supposed to take anytime you are around pregnancy in the beginning stage, especially. All right. And don't forget, I'll be teaching you something, and then I'll be giving you a little quiz, and the person who gets it correctly will get this book for free. Okay. So I want to introduce what we are doing for those of you who are new to the episode. My name is Dr. Otubo Victor Ogemde. That is Dr. Ovo. And several years ago, I was around 10 years old, and I lost my youngest sister to something that shouldn't have killed her. If she was alive today, she would be in her 20s, probably done with the master's or even doing her PhD. She had febrile convulsion. And when she had the febrile convulsion, everybody around her, the elders who were there, because I heard the shout and I rushed out, pull her leg over fire, do this, do that, do that. As they were doing all of those, they made her life very, very complicated. Her legs got burnt. She was hospitalized for 3 months and eventually she died. If just one person among all those people knew the proper thing, she would have been saved. So I decided I would become a medical doctor. That was my decision that day. I was 10, but it was strong, and eventually got into medical school and realized that what happened to my sister was not in any way unique. Many women, many mothers were suffering from the same thing. Many families were losing their children. And to many of my colleagues and my seniors and my teachers, it was cases, but to me, they were painful experiences. So I decided I was going to do something about it. So when I graduated from medical school, got into practice, it became so severe. I decided to put down together a material that contains everything you will need in all stages, from before you get married, the things you need to know so you don't complicate your health before you even get to pregnancy, before you even get to marriage, and now begin to have challenges with pregnancy. And then we'll look extensively into the period of conception, which is part of what we're talking about right now, and the complications around this. Then we'll look into pregnancy, and summary is that it is a journey. It is a family companion. Every home must have it. And this is not my words. This is the word of the Medical Women's Association of Nigeria. And I didn't write it in a way that is full of medical rhetorics. No, simple language that everybody will be able to understand. And it's not yet public. When it's public, we're trying to get 1 million copies distributed nationwide through partnerships with philanthropic organizations. But it also be available for purchase, but I'll let you guys know when that is time. So we decided also to begin to teach this book chapter by chapter, and share everything that is inside here in stories, in simple ways that you and I can always relate with it. The goal is to translate it to multiple languages so that everybody across Nigeria and even around the world could have access to it. So we're going to have it in Yoruba and Hausa and all of that, and in Igbo language, and even in Pidgin. And it will be aired across the entire state and the FCT. And this is happening because of the assistance and the partnership of the Medical Women's Association of Nigeria, for which we are very grateful for what they are doing. Okay, so maternal mortality rate in Nigeria is highest worldwide. It is 29%. If 100 women die around the world from pregnancy-related matters, 29 will die from Nigeria. And this is on the background that Nigeria actually contributes only 2% of the world population. So it's just unthinkable. It's unthinkable. It's unthinkable. Like, I don't know how to put it. It's just unthinkable. But when we've looked into this matter, we realize that almost 70% of all the cases of maternal mortality were related to wrong information, people not knowing the right things. So their life already complicated even before they get to pregnancy. And even they continue to carry the wrong health-seeking behavior into pregnancy, and then things become very complex. And that's why we're doing this. For you listening to me, this may not be of concern to you right now. Keep inviting. Make sure this link goes everywhere. Call your friend, call your mom, call your dad, call your sister. Everyone needs to be on this call right now. 4 a.m. yesterday night, I got a chat from someone because of something I posted on my status. He's telling me that, Doc, I've been, what's it called? I and my wife, we've been married for 6 years. Now, we've been having miscarriages. He said they finally got a child, they finally conceived earlier this year. But unfortunately, they had miscarriage again after 3 months, and the baby had to be evacuated. And it is from my status he's seen rhesus as a factor to even consider at all. I had to send him the video, which was a previous episode. If you've not watched that, go and watch it. It's very, very educative. And we had to get on the call and then begin to see how we can take that up. If anyone told that family 6 years ago that this is marriage 6 years later, you won't have a child, they won't believe it. So this is not a matter of, God forbid, it's not my portion. It's a matter of knowledge. If you have the knowledge, if it happens to you, you do it, you react better and you come out of it. If it doesn't happen to you, glory be to God, but you already have the knowledge and you are doing the right thing. But most persons, it will be their situation without the right knowledge. Okay? So at the end of the call, I'll tell you all opportunities that are available for those who are interested in volunteering and helping to spread this message all across the world. We'll be dropping links to the WhatsApp group where you can join the chat, ask your questions. We'll also be dropping links to the volunteering for those who want to volunteer and spread the news. You'll be receiving your transcript and certificate of volunteering, which will be recognized all over the world. Okay, without wasting much time, I want to welcome the guest that we have on the call today. And she is an amazing person. She's been on the waiting room for long, and I would like to admit her right now. Okay, so just give me a moment. Okay. Amazing. Doctor, how are you? Your camera is turned this way. Can you try to work on it to come the other way again? Portrait, just, okay, good. Beautiful. How are you today?
Good evening, Dr. Vo. I'm
Good
doing
evening.
well.
Thank you. Your
How are
volume
you?
is so low. Can you like tune it up?
Good evening, Dr. Vo. How are you
Yeah,
doing?
I'm good. I'm
Is it
good. I'm good. Okay. Yes, I think it's good. I think it's good. If that's the loudest it could get, let me check something. Can you try speaking again?
Good evening, Dr. Vo. How are you doing?
I'm good. It's not really the loudest, but is that the loudest it could be?
And my volume has reached the loudest, though, unless you want me to connect it to speaker.
Okay, no. All right. Okay. But you hear me very loudly,
But you can
correct?
adjust from your end. Yes, I can hear you very well.
Okay. Okay. All right. Okay. Okay. Let's get to it. So welcome, Dr. Zinobia Ikpeze, correct? I hope I got that very pronounced it correctly. Okay, so
Thank you
she's a
very
senior
much. Good evening,
registrar.
Dr.
Thank you. Thank you. She's a senior registrar in obstetrics and gynecology at NIUT, Nnamdi Azikiwe University Teaching Hospital at Nnewi. And she's won several awards as a clinician and also as a published researcher. And her dedication is towards advancing maternal and child health. As a matter of fact, she is the Medical Women's Association of Nigeria National Maternity Secretary of the Medical Women's Association of Nigeria Maternal and Child Health Committee. So we're talking to the right person. Everything we'll talk here will be documented accurately and distributed nationwide. So she combines her clinical expertise with leadership in women's health advocacy, medical education, and community outreach, both nationally through SOGON. SOGON is Society of Gynecology and Obstetrics of Nigeria. And then she also has her activities internationally through FIGO, International Federation of Gynecology and Obstetrics. All right, so Dr. Welcome. It's so good to have you.
Thank you very much, Dr. Good evening. Good evening to all our listeners. I'm happy to be here. You skipped one of my names. I guess it was difficult for you to pronounce.
No, it wasn't. Odigonma.
Yes, so that's what people know me majorly by, so I'm happy to be here. It's good.
Thank you so much. So while we wait for everyone to get in their guests, the people they invited on the call, I'd like to just engage you a little. Tell me about medical school. So where did you study? I studied in Ebonyi State University. And that's where the best doctors are trained anyway, globally. So I don't know where you studied.
Okay, we're not going to debate on that. Everybody feels their school the best. So I schooled, my university was in Nnamdi Azikiwe University,
Okay.
Oka. Yeah, I had my secondary education in Queen's College, Yaba, Lagos. So, and now I'm doing my postgraduate residency in Nnamdi Azikiwe University Hospital.
Amazing.
So
Amazing.
I don't want to you the statistics online. You're repping a boy, no problem. But then check out NIUT online.
There's just a recent exam concluded. I think the part one exam. It happened, I think, a couple of months ago. The lady who won the best in internal medicine, she's from Ebonyi State, and she also studied in Ebonyi State. I'm just trying to
And the
say
lady
Ebonyi
that
State
passed
has
on
some
the
of the best.
torch, the lady that passed on the torch to her in internal medicine is from NIUT.
You're talking about former things. I'm talking about current reality. The current things are happening.
Okay. Let's not argue. Both hospitals are doing well.
Yeah,
I mean,
that's
they have
true.
you, they have me. So
That's true. That's true. Okay.
And the volume is good.
Okay. All right. So I want us to get straight into the conversation. Today we have everyone on the call and everyone is listening. Last week we shared on something very interesting. We looked at blood compatibility for marriage. And we discussed extensively on rhesus, particularly because it's silent. Many people know about ASAS and even churches preach about it, but very few persons understand the rhesus. In fact, I've interacted with 207 women on this as at the time that this material was published. Only 2 knew the significance of that positive or the negative that comes to their blood group. So, and people don't even know that those things could lead to complications in conception and fertility and all of those stuff. So we looked at it very extensively last week. We also touched on the AS genotype. And currently, what many people are doing is insisting they'll get married, and then if they check and it's not what they want, they will remove it. That's the psychology out there. So, and we, trust me, we did justice to it. It was very, very amazing. So today we want to get into chapter 2 of this material. And I want to read the story and then we get into the conversation because that's the essence. And everyone who is on the call, I want you to listen very, very closely because the entire conversations we're going to have is based on this woman's experience. All right. And then remember, I told you I'll be teaching us on how to calculate your ovulation within this course. So you know your fertility period. And then I'll ask you some questions. And one lucky person who gets the answer correctly will have a free copy of this book from me. All right. So let's proceed. So this is Gina's story. Gina says, I thought it was just my period. So let me read. My name is Gina. We've anonymized this name. This is not her real name, all right? But every other clinical data is maintained. Her age, marital status, circumstances around it, but locations, name, all those things that are key in identifying her in the biodata has been changed. So my name is Gina. I'm 27 years old, married, currently 3 months pregnant. But this is not the first time I'm being pregnant. A year ago, I lost a set of twins. Babies I didn't even know I was carrying until it was too late. It all happened shortly after the December holiday. I had traveled to the village with my husband to spend the Christmas and New Year with our extended family. We were happy, excited, caught up in the usual festive busyness, cooking, visiting relatives, late night gists. A few days before we returned to the city, I noticed some spotting. I thought it was just my period, even though it looked a little different. It was lighter than usual, but I didn't pay much attention. After all, I've been trying to conceive for 2 years without success. I cleaned up and carried on. I even helped roast plantains and pounded yams the next day. Back in the city, I started feeling unwell, weakness, body aches, and a bit of fever. I didn't think much of it. Malaria is common around here, and I just assumed that was the case. I went straight to a pharmacy and bought ACT anti-malarial drugs. I had taken them before, so I didn't see the need to even speak to a doctor. After all, what could go wrong? But after finishing the medication, I still felt sick. It was at that point that a neighbor told me about a herbal mixture that worked like magic and insisted I tried it. I was tired of feeling the way I did, so I took it. Still, I didn't improve. One night around 2 a.m., I woke up with a strange feeling. I stood up and saw blood all over the bedsheet, dark red with clots. I panicked. My husband rushed me to the hospital that early morning. That was the day I found out that I had been pregnant with twins. The spotting I thought was my period had actually been an early sign of pregnancy. The anti-malarial drugs I took alongside with the herbs my neighbor recommended, what? They were potentially harmful to the pregnancy. My doctor called it a threatened miscarriage. But by then, one of the babies had already gone. The second one was still there, but eventually didn't survive either. The pregnancy had to be evacuated. I remember lying in the hospital bed, not just, crying, not just for the babies I had lost, but for the ignorance I had carried. If I had just taken a pregnancy test when I started spotting, if I had waited before treating myself, if I had asked questions before, maybe I wouldn't have lost them. So, my dear, if you are sexually active, whether you are planning to conceive or not, please be careful. The moment you feel unwell, pause. Don't rush to treat malaria or any illness until you are sure you are not pregnant. Self-medication can be dangerous, especially in the early stages of pregnancy, when you may not even know that you are expecting. Also, don't ignore spotting. It might not be your period. It could be your body's early sign or signal that you are pregnant. or that something is wrong, actually, always check first. A simple test can save a life. 2, in my case. And that's Gina's story. And it's painful. I met the lady last year, and I had the experience. She's married to sorry, I'm about going to the data we're not supposed to be revealing. Okay, so yeah, so I met the lady last year, and I heard her story, and then I encouraged them. At that time, they were not yet pregnant. They got pregnant this year, and then I've been following up on them on their pregnancy. I think this should be around their 8th month right now. So by next month, they'll be delivering. So, sorry, they got pregnant late last year. Then they're 8th month right now. Okay, so let's get to the conversation, doctor. All right, let's get to the conversation. Some documentations from WHO, the old guidelines, it advised that ACT, anti-malarial drugs, which we are going to talk about at the end of the video. So I need everyone who is present to watch to the end so you don't jump ahead of things. So we're going to list what those drugs are. So how you know a drug is ACT? When you go, you see it written on the body, but how do you know? All right. The WHO recommended that these drugs are safe in the 2nd and the 3rd trimester, but they are not safe in the 1st trimester, and recommended another group of drug called quinine and then clindamycin, a combination, which can be taken orally. All right. But more recent studies in 2020 by some group of researchers, even 2023, showed that even this quinine and clindamycin were even more dangerous than ACTs in the 1st trimester of pregnancy. As for someone who is listening, 1st trimester, we're going to look into that. What is 1st trimester, 2nd trimester, 3rd trimester, okay? But just understand in the early periods of pregnancy. So that it could lead to miscarriage, it could lead to birth defects. Birth defect is when a child is born, you see some abnormalities in the child. It could affect the brain or even their bones or their connective tissues. Just a lot of things could just happen. Then it could also lead to stillbirth. The baby will be carried and then die in the mother's womb and be delivered as a child who is not alive. All right. So those were discoveries. Now in 2019, Ballard and some other researchers together published a paper that established that the outcomes were better in all women who did not take any ACT at all or anti-malaria compared to those who needed to take anti-malaria. All right. So in our environment here, we have, if you turn here, you see malaria. If you turn the other side, you see malaria. So doctor, this is your domain. This is, you guys are the one handling this. Can you tell us how bad is malaria in pregnancy? To what extent is this a very bad stuff for women?
All right. Thank you very much, Dr. Bo, for that story and the introduction. Malaria in pregnancy is a very important topic and is a major health problem. Like you stated, anywhere you turn, you see malaria, especially in this part of the world. It's endemic in this part of the world, so it's particularly important. In pregnancy now, it's even more important because now you're dealing with two people, the mother and the baby, and malaria can affect either of them. People don't know how bad malaria can be. So for the mother, you can have even a very severe disease that will need admission into the hospital. So when a mother has malaria, it can lead to anemia, which is the blood level being low. It can lead to preterm labor. It can even lead to miscarriage that we're talking about. It can lead to your baby dying in the womb. And then for the baby, it can make your baby not to grow so well. You give birth to a baby that has a very low birth weight. It can also make you to give birth to a baby that dies immediately after delivery. Okay, so malaria is very important in this part of the world. And even though some people have immunity, kind of have immunity, outside of pregnancy, but pregnancy has been shown to reduce this immunity that we have for the pregnancy. So it's very important in pregnancy. Thank you.
So that makes that pregnant women are more vulnerable to malaria.
Exactly. Amazing. Especially first-time mothers.
First-time mothers. So this is why prevention is the message. Like in the
Yes.
clinics, in all the places, like in my training and practice everywhere, once you go to the antenatal place, the message is prevention. So what's the recommendation? What do you tell women right now about how to protect themselves from malaria in pregnancy?
Okay. So there are different modalities for preventing malaria in pregnancy. So first, for a woman that doesn't have, like we're talking about prevention, we're talking about things you can do, modify your lifestyle by like wearing long-sleeved clothes, like you're putting on a suit. So in the evenings, especially when the mosquitoes tend to bite more, you can wear long-sleeve clothes, trousers,
Okay, they can wear suits,
tops
right?
that are long
In the
sleeved.
evenings.
All right. They can wear suits if the weather is cool. Okay, then you can also use insecticide treated nets. If you remember a couple of years back, the World Health Organization did a program, roll back malaria, they were sharing nets, and even up to the last couple of years, we still distribute these insecticide treated nets in the antenatal clinics. So it's very important that women that are pregnant and also with their children that are under 5 use that insecticide treated nets. Then also they can spray. We have a lot of, insecticide spray, but it won't be the pregnant woman spraying, because we've had stories of, somebody saying because of this, it affected my baby, so your husband, your sister, anybody in the house can spray while you move away from the room for a couple of hours. So in the evening you can spray, and then, that helps a lot. Also, some people use repellents. Though we don't know how safe it is for the pregnant woman to use these repellents because, they contain chemicals, but these are some other ways. But then specifically for a pregnant woman, from the second trimester, which is from 14 weeks, we give intermittent preventive therapy.
Yeah, I was about to come to that. Yes.
Combination of drugs. So for a woman that is registered for antenatal, from her second trimester, she's qualified to take this intermittent preventive therapy, and is given every 4 weekly until she delivers.
Amazing.
So these are the methods that we use.
So the idea of this preventive malaria treatment you give, they're not ACTs, right? I think they're the SP, the sulfadiazine pyrimethamine, right? So
yes,
they give them as one single dose.
Treatment.
Okay, great.
Yes.
And then you take it, and then in 4 weeks again, up until delivery. But what about in the first trimester? If a woman comes down with malaria, what do you do? What do you guys do for them?
Okay, so a woman comes down with malaria in the first trimester. First of all, well, this is usually the presentation to the hospital, because most of our women don't book their antenatal till like second trimester, and all, which is wrong. But in the first trimester, medicine, science, research keeps evolving. Yes. For now, the World Health Organization still recommends the use of quinine, clindamycin, or the use of ACTs if there are no other effective
but this is under the doctor's supervision.
Yes. All drugs should be administered under the doctor's supervision.
Yeah, so it's not like the woman should just go to the pharmacy and say, hey, give me this drug and all. All right.
No.
Okay.
Some of them are not even competent to know which ones should be given to a pregnant woman. So please, if you're sick and you're pregnant, it's better you come and see your doctor in the hospital.
Okay, let's jump to the main conversation, like, because we're already at the end. Let's get to the beginning, because before you get to pregnancy, you need to at least begin to see a period, right? Which is the puberty, where all of this entire stuff begin. And it's we call it first principles, right? It's applicable in all disciplines. So when you understand the foundation of something, you could build on it very well. So on menstrual cycle, which is the beginning of the possibility of getting pregnant, puberty for most women or for most girls is 8 to 13 years old, right? And I remember when I was in primary school, we got to school health education class, and then the teacher asked, what are the signs of puberty? My hand was up immediately. So, and she asked us to come. Those days, if you want to ask a question, you come to the front of the class. I think they used to do those things. I don't know if they still do them to boost confidence and all. So I came to the front of the class to demonstrate my answer. So I said, the guys would develop a strong voice, and then the girls would develop fine voice. The class laughed. Then I said the guys would become masculine, and then the girls would start having breasts. And then I talked about armpits, hairs in the armpits. But the funniest part, doctor, and I pointed downwards and said that there will be hair in the public area. Now, nobody laughed except from the teacher, right? But I was wondering why she was laughing, right? I mean, it's not a public area, but that was, as a child, you're just giving information. I didn't see it was public area. I just read it was public area. So hairs in the public area. So I will never forget that. Now in puberty, that's the period where a woman starts seeing her period. That's when menstruation actually starts. And it's very important to understand it. Most people understand their menstrual duration because it starts and stops. So they will tell you it lasts for 2 days, it lasts for 3 days, it lasts for 4 days, it lasts for 5 days. But many of them don't understand the length and why it is important. For some person, they will even call it monthly period or monthly cycle, but it's not monthly. Some people can have it 2 times a month because of how the cycle flows. So for someone who is watching us right now, this sounds very pretty busy, but we're addressing both those who are watching us now and those who will listen to this later in rural places. But this, like I told you, will be translated to multiple languages, right? It will be translated to Igbo, Hausa, Yoruba, Pidgin, and gone to the deepest part of communities for them to hear this. So can you explain to someone listening to this the easiest way to calculate their cycle and their menstrual cycle to know that, okay, this is how long it lasts for me, and that is why it's different from the other person?
All right, thank you very much for this question, because everything around a woman's journey in her reproductive life is based on the menstrual cycle. So it's very important that we understand it and how to calculate it and all that. So because often we see women who don't know how to calculate their menstrual cycle, you think it's basic, but it's surprising that many women don't know how to. So usually we start the calculation from the first day of the menses. Let's say we're in August now. The woman sees her period, it starts 1st August. We take that as day 1 of the menses. That is the day 1. So you start counting from that day. Okay? So let's say the period runs for 4 or 5 days and then stops. Then the next one starts on the 28th of August. That means the woman has a 28-day cycle, because the interval is 28 days when you count it. So you start from the day of the first menses of the last period to the day it comes out again. Whatever interval you get, that's
amazing.
That's it.
So if my period, if today is 1st of January and my period starts flowing today, I'll count that as day 1. Then even if the period stops on 4th of January, I should continue counting.
You keep on counting till it comes again.
So let's say on the 30th of the same January, the period comes again. I will now know that my cycle is from 1st to 30th, so it's 30 days.
So you have the interval, 29 or 30 days,
29.
Interval.
So now, I will now count again. From that 30th of January, I should expect that if February is 29 days for that month, for that year, I should be expecting my period again to start on the 29th of the next month, being February, being another 30-day interval.
Yes.
29, 30-day interval. Amazing.
Yes, so that's the important thing, because some people, count it by day. They'll say, oh, I saw it on 28th January, and then it's coming 28th February. So that's 28 days. No. And so people keep on expecting their period to come the same day every month. It's not going to be the same date. It's going to change.
You're going to
So
change.
the important thing is to start counting the first day to the next one. By the time you do it over 2 to 3 months, then you can know what your cycle length is.
Your cycle, because maybe within those 2 months, there may be a little 1 day gap or 1 day forward. So after 3 months, 4 months, 5 months, you can establish that my cycle is this period, number of days.
Yeah.
Okay, let's talk about why is it important to track this, right? So the first that immediately comes to mind is to not get a surprise, right? You don't want to just be somewhere. Imagine that you're a public speaker, or you're a bank CEO or a manager or a branch manager. And then on a Monday morning, you're giving your rounds and giving instructions. Okay, sales department, this one department, and suddenly, blood drops. That's not good, right? So that's the first reason why you need to track it, so you be prepared for it. Because some people don't get the signs. Because in some women, they start having the cramps ahead of time. Or some people, no pain. You just start. And that's why it's important. Number two, it's when you understand your cycle length, you'll be able to track your ovulation. Because everything, like Dr. Odigonma already said, about your reproductive health falls within that cycle. If you understand it, you can plan your life reproductively within those windows. Then number three, when I was a child, I used to watch movies. I'll hear someone go and tell the boyfriend, I missed my period. I kept thinking about it. Do you understand it? And then once they say it in movies, everyone becomes quiet. I just kept wondering until I grew up to now see it. Okay. So the third reason why you also need to track your cycle is so you know when you get pregnant. Most persons don't even find out they're pregnant until 3 months. And when you hear people say that, you as a doctor, you want to get surprised. Doesn't mean you missed your period first month, second month, third month, and you didn't bother. But over time, now when I got married and then I have my wife, I realized life can be busier than your period. I mean, you could get so involved in something. Let's say you're preparing for a professional exam or you're pursuing a contract. There could be so much happening in your mind that you're not even keeping track of what's going on. So, and you see such things happen. So it doesn't even have to be for a busy executive. It could even just be a young girl who is just trying to figure out her jam. I mean, that's enough to occupy your mind completely. At different stages of our life, life appears as though that is all that is happening. So you hear someone's problem, you're wishing we can exchange problems, right? But at every point in time, what is worry is enough to occupy your mind completely. So these are part of the reasons why you need to track them. I'm going to be dropping in the chat room, in the comment section, a link that could help you automatically track your menstrual cycle every month. So once you impute the first day of your first period, and the next time it starts, if you do that just 1 month, automatically it continues to track it for you and send you reminders every period. And that's a gift for being on this call. All right. So let's get to the proper question, doctor. Let's start with ovulation. All right.
Yep.
Which is, we'll say that part of the reason why we track our menstrual cycle, so we can also identify our ovulation. Can you explain ovulation to me like I'm a 5-year-old child?
Okay. So ovulation is a time in your menstrual cycle you're most likely to get pregnant if you have unprotected sex. Okay, so it's when a woman releases an egg that is per.
Can you come again? I think we lost you briefly.
Okay, sorry about that. I said ovulation is a time in your menstrual cycle, obviously not, your wife's menstrual cycle, where she's most likely to get pregnant if she has unprotected
Can I interject
sex.
a little? Can I interject a little?
Okay.
I want to speak on behalf of all the men who will watch this video later. We see our period is not once a month. We see a period every day.
Okay. Twice daily, go.
We see period every day. Every day they call you on the phone that there's school fees, period. They call you that there's this. Once a call comes, that's period for the man. Sorry for cutting you in. Okay, please, can you continue?
Okay, no problem. So it's when the woman releases an egg, which the sperm from the man is capable of fertilizing. So if you meet your husband, you meet your boyfriend, meet anybody around that period, that's when you're most likely to get pregnant within your cycle, whether it's 28 days or 30 days. Yeah.
Amazing. So can you give us like, let's say a lady, her ovulation is today, with respect to that day, what's the window for that woman to have sex with the husband or the boyfriend or whoever, and there's chance of pregnancy?
Okay, so if today, first of all, it's difficult to know which day in particular is your ovulation, right? So, but there are assumptions.
Yes.
We usually use the 28-day cycle as, okay, the example. So for the 28-day cycle, she's likely to ovulate. It's not a must. She's likely to ovulate on day 14, okay, of that menstrual cycle. So if she meets with her husband 3 days to 5 days before that day 14, that's after the period has stopped, from around day 8, day 9, she meets with the husband up until that day 14, and then extra 1-2 days, she's likely to get pregnant.
Amazing. Amazing. So, and I think this is because of the fact that the sperm,
the egg,
when a woman is when a woman is ovulating, her reproductive tract is prepared to receive the sperm. So there are secretions that is released within that period to make that the woman's reproductive tract is not too acidic. So when the sperm gets into her body within that period, give me a sec. Okay, can you hear me very well? Let me be sure I'm here.
Yes, I can.
Okay, good. Now, when the sperm gets in there, in that period where the woman is ovulating, that season of her ovulation, now science has shown that that sperm can last up to 3 to 5 days waiting, which is why, like you mentioned, if she's ovulating today and she begins to have sex with whoever 3 to 5 days before that day, that is a period she can get pregnant. So if she has sex on day 5, let's say her period is this day, and these are the days before this day. If she has sex this day, that sperm can survive till her eggs comes out. If she has sex on the second day, it can still survive. If she has sex, she has sex up until the day the ovulation happens. If she has sex on the ovulation day proper, she can also get pregnant. If she has sex the next day, she can also get pregnant. Now, there's something about the egg which looks like women generally. Doctor, I'm going to shift a little now so you don't punch me, okay? Now, the eggs don't last more than 24 hours. Once the egg is released, you can't keep the egg waiting, just the way you can't keep a girl waiting. If you keep the egg waiting, she'll just go. So the moment the egg is released, there should be a sperm already coming, or there should be a sperm coming immediately. So it's either the sperm is already waiting for the egg, or that the moment the egg is released, the sperm comes immediately. And this is why that ovulation tracking is very important, because let's say a woman has a husband working in Lagos and she lives in Jos. And then the husband comes every month for weekend, once a month. And he comes 3 days after she ovulated and they have sex. the eggs are gone. So they will have sex and then they won't conceive. The man comes back another month, let's say within the same period, 4 days after her ovulation, they have sex again. And 2 days, 3 days, he travels back to Lagos. This can continue to happen for days to months to years, and they won't be having conception. They won't be having children. And they will think it's a spiritual problem or it's a medical problem, but it's just the lack of knowledge. And this is why understanding that ovulation something is exceedingly important. But doctor, let's switch from the fertile period. Many of these people who are on this call, some of them, not many, are not interested in that fertile period. They're interested in the safe period,
Oh,
right? Some of them, I'm not
okay.
saying everybody, all of them who are not
Okay.
married, who are on this call, they want to know, when can I have sex and it will not result to pregnancy? And I want to have unprotected sex. It's not the best for you, not even on a religious ground, but also medically, because of diseases that are very common these days. But let's still talk about it, because part of the challenges we have is part of one of the leading causes of maternal mortality in Nigeria is pregnancy outside marriage. In the hospital, when we see a woman, when I did my postings in ONG and when I was in medical school, ONG is not my specialty, so I talk about it as something in the past. But when I did my activities in obstetrics and gynecology, one of the things that fascinated me in with obstetrics and gynecology during my postings in the unit was the question you guys ask patients. One of them is so unclinical. It has nothing to do with medicine per se, but it makes a lot of sense to my mind psychologically. And that question, people always ask the patient, is this pregnancy desired? All right. More like, this is not useful, but like that's the what it communicates. Like, did you and your husband really plan to have this baby? Because the state of mind, the preparation, the readiness for pregnancy is extremely important, very important, as to how much support, that pregnancy receives, which eventually determine the outcome. And I said that to talk about what I was talking about earlier, about why one of the causes of maternal mortality in Nigeria is pregnancy outside marriage. Because oftentimes the support is very limited. Some people also don't have the families to support them because of the stigma, especially in this part of the world. So a lot of things, and we don't have a social infrastructure government-wise to support this kind of people. In fact, in some circumstances, schools even send out such students. So the environment is not completely healthy for that. So it's part of why this question is very important, right? So what is the safe period, and how can a woman understand her safe period with respect to what we've talked about ovulation?
All right. Thank you very much, Dr. Wu. It's very important that, you plan your pregnancy, like you said, in terms of support, the psychological preparation, the funding and everything. It all goes a long way to project how that pregnancy is going to end. Okay, so safe period, we said ovulation is when you're most likely going to get pregnant. Safe period now is a time during the woman's menstrual cycle that she's least or not likely to get pregnant, even if she has unprotected sex. Okay, so based on the time of ovulation, right, from the end of the menses, when her period, let's say she has a 2, 3, 4 day flow, from when her period ends, she's safe from that end of menses till that ovulation time, the 5 days prior to the ovulation date. Then
Yes.
after ovulation, from 2-3 days after that ovulation. That's if it's a 28-day cycle from day 19, day 17, and she's ready, she's safe till the next cycle. You know, some say, oh, from 1 day after ovulation is safe, but you never really can be so safe. So some say 2, 3, but if you give 5 days before ovulation, 5 days after, as the fertile window, then every other time within that cycle, you're safe.
It's safe. So
but everything is not 100% too.
Yeah.
Anything that stands all this pregnancy and COVID, before you say, even though I get to, because also a lot of women don't have a regular cycle. You understand? So you can't really predict when is your ovulation. And that is what affects every other thing until you can say, oh, this is when I'm ovulating. Then you can completely say I'm safe this period. So it's dependent on your ovulation. Yeah.
Very correct. So let's say my ovulation is on the 10th of this month. The month, let's say in the 10th of January, I've determined that that's my ovulation day. Right?
Okay.
So because when a woman starts ovulating, there are signs that will show it, which we are going to talk about. So if she's ovulating today, the safe period is
10th January, right?
10th January. We've already established that the egg, once it is released, lasts for 24 hours. And if you keep it waiting, it goes away. And that results in a woman having period. So if the egg is released on the 10th, by 11th, it has waited enough. He did not see any guy who came to ask her out, right? So the egg says, I'm done waiting, and then dies. Then day 12, because some people can be stubborn, they will say, let me still wait and know if he will come. We say, also allow day 12, 2 days after. But then there are also some other people who will say, I will wait very well for that guy. We say, wait for 3 more days. So 3 days after ovulation, all things being equal, the egg is gone. So from day 4 is a safe window. If she has sex, even unprotected, the chances of being pregnant is very slim. But there's a catch, which I'm going to emphasize like she talked about. Then, before her ovulation too. So if she ovulates on day 10, which is 10th of January, for instance, if she has sex on day 5, which is 5th of January, that sperm can keep waiting. Like I told you guys, some sperms can wait for 5 days. So it can wait from 5th, 7th, 8th, 9th, and sees the girl on 10th. Bam, pregnancy happens. Day 4, which is on 6th of January, is not safe. 7th is not safe. 8th is not safe. 9th is not safe. 10, which is the ovulation, is not safe. 11 is not safe. 12 is not safe. 13 is not safe. Then from 14th, she's free. Then before 5th, let's say from 4th, 3rd upward. So 5 days before ovulation and 3 days after ovulation is the window of fertility. Then the other windows are the safe period, except of course, the period where she begins to have her period. If she's bleeding, of course, she can also not be having sex during that time. No longer based on safety about pregnancy, but also now hygiene and other things. Then the fact that there are things that can make a woman's because this entire process is regulated by hormones. There are things that can trigger the hormones to just behave somehow. Certain medications, you're under stress, even emotional stress, right? Just someone serving you breakfast is enough to trigger. I don't mean literal breakfast like food. I mean like that. I'm not talking to you, doctor. I'm talking to everyone who is listening. Okay. Please get ready now. I'm about to teach you how to calculate your ovulation day. A probable date, not the specific, but probable. But it can help you to make a lot of predictions, okay? So those are the things around that. Let's talk about how to calculate your ovulation cycle and track your day of ovulation. Doctor mentioned something earlier. about using 28 days. There's something called the luteal phase of menstrual cycle, and all things being equal, it lasts around 12 to 14 days. It's almost a constant factor. Based on this variable, we now make a prediction. And I want you to write this down. This is how to use this factor to predict your ovulation day. Your menstrual cycle length, you need to establish it. So if your cycle length is 28 days, establish it and keep it one place. So menstrual cycle length, 1 minus luteal phase, 14 days, equals to your probable ovulation date. So let me say it again. The menstrual cycle length, if you're 28 days, minus the luteal phase length, estimated 14 days, equals to your ovulation date. We're using this prediction to come around the fertile window. We're not using it to come around the safe period, because the fertile window is wide. You are trying to get pregnant within this range of time. So you could play around it. So let me explain it again. So if your cycle length is 30 days and you minus 14 from it, what remains is what? 16. That is your ovulation day. How does it apply literally? It means if you start seeing your period today, 16 days time, you ovulate. So if your cycle length is 28 days minus 14 equals to what? 14. So if you start seeing your period today, day 14, your ovulation is already happening. It could happen 2 days before or 2 days after, but it is within that period. If your cycle length is 30 days or 31 days, 31 minus 14 is 17. So if your period starts today, count 17 days time. Your ovulation has happened around that period. So what it means is that you should have intercourse with your husband within that period. 3 days, 4 days after that day, that cycle of period is your ovulation day, is your ovulation date, is the window for ovulation. So like we say, you may not be specific, but you've gotten a gauge. It cannot be more than 2 days before or 2 days after it. You're within a safe period. You are within a period where you can actually conceive. And this is very important on some aspects. Doctor, this is a very probable thing, but I've heard people talk about it, about using your ovulation to know whether you can have a male child, a female child, because the male sperms, the XY sperms, they move fast and they die fast. How true is that? Before I get into the conversation, how true is that? Is it true? Is it, people talk about it a lot?
That's
It's
so
a
you
conversation. I've
want to
even seen
set
some health articles
right?
about it.
You want to set me up, Dr. Vu. But anyway, it's true to some extent. Like I said, anything concerning pregnancy, fertility, and all that is not 100%. Yes,
Yeah.
some have used different methods to achieve that. There have been, cases, but it's not always 100%. Okay, that's in terms of using just the ovulation, the tracking, telling the woman, meet your husband so and so time, meet only once, and all of that. But then there are newer methods. I mean, you can do IVF with sex selection and all of that, which will give a higher guarantee. Okay, so, but still, some use that method and it's okay. But I'm not going to say the method so that some people will not sue me and say it didn't work. It's not going to work for everybody. So, but
Okay,
contact your
let me say
gynecologist.
it. Okay, since I'm not a specialist in this field, so I'll just say it. Okay, so so my mom told me she used it and that it worked for her. That she heard it from a doctor and she used it. We have five guys in my house with one lady, and
Oh.
my mom said, "Can you hear me, doctor?"
Yes, I can.
Okay, so my mom said every time she starts ovulating, she notices she's about to ovulate, she immediately goes to have sex with my dad. All right. And it worked for her. She had boys, 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 boys.
We're
Okay.
going to look out for other things that could have contributed to the male children. But
Yeah,
anyway, that will be a topic for another day.
that is tough for another day. So, but I think I'm raising a lot of. If you want answers to that question, drop it in the comment section. Let's move on to the main thing. How can you use ovulation to determine if you want to have male children or female? And if you need that answer, let me see it in the comment section and then we'll talk about it. So I want to give you a quiz right now. And this is where I'll be giving out this book for free to a lucky answer. All right. Just so you know, this book took me 2 years to write. Right. The Medical Women's Association of Nigeria has rated it as one of the best family health book ever written. It's very exhaustive. More than 400 journal materials are referenced in this book. It's so rich, it's so thorough, it was done with family at heart. So that's the gift I'll be giving you. 2 years of work. And the office I'm in right now is an office in my home where I stay to work. For the period where I wrote this book, I stopped every work outside. I stopped my businesses outside the country, my businesses within the country. Everything was paused. I delegated responsibilities and I faced this book squarely. So when I say I'll give it to you as a gift, it's not just I'm not just giving you, I'm giving you my life. I'm giving you 2 years of my life as a gift. So I'm saying all of this just so you appreciate.
Can I participate in the quiz?
Come again?
Can I participate in the quiz?
No, you cannot. But definitely for being on this call, you have a free copy for yourself too. Yes. Okay. So this is it. This is a question. Your girlfriend gets married on the 22nd of December. Her period started 7 days later on the 29th of December. Her menstrual cycle length is 29 days. She wants to get pregnant immediately. They're going for honeymoon with the husband. She wants to get pregnant immediately. You attended this conversation with Dr. Ovo and Dr. Odigonma, and we taught you how to track your ovulation. What advice would you give her on the probable date that will be her ovulation day? And when will you tell her to start having sex with the husband? Let me repeat the question. You're a lady, you were ashebi with another lady. You did ashebi for her wedding on her wedding day, right? So she gets married on the 22nd of December this year. Then because you're always posting health thing that Dr. Ovo posts everywhere. She said, hey, come. That thing you were talking about in August, I want to get pregnant immediately. And my cycle length is 29 days. And today is 29th December, 7 days after my wedding. My period have started. My cycle length is 29 days. When will I expect my ovulation to happen? And when should I start having sex with my husband? For those of you who are just joining now, let me give you the benefit, how to calculate it. If your cycle length is established, minus 14 from it, whatever is remaining is the date of your ovulation. So if your cycle length is 30 and you minus 14 from it, what do you have? 16. What it means is that if you start seeing your period today, count a total of 16. Today being 1, 2, 3, 4, 5. In 16 days, your ovulation will happen. Basic. So with this thing I told you right now, start answering the question in the comment section. And at the end of this call, I'm going to be looking to see the correct answers. And among all those who got it, I'm looking at the answer right now. I'm tempted to say it. but I will not say it. The people who got it correctly, a lucky person is going to get the book. So let's progress to pregnancy, doctor. Okay. We've talked about a lot of things leading up to pregnancy proper. So when a lady gets pregnant, she has symptoms that shows she's pregnant because that pregnancy is a foreign body. All right, the sperm that fertilizes the egg and the new thing it forms, it's foreign. Her body hasn't seen this before. So the body will begin to react and a lot of things will begin to happen to the woman leading up to implantation, right? And for implantation to happen, when the egg and the sperm fertilizes, I'm giving a very proper background so that everyone who is listening can get once you start hitting us with the answers to some questions we'll have from people. When the egg and the sperm meet, they form something different. It is no longer egg, it is no longer sperm, it has become a child. That is why the Catholic Church says that if you remove a baby that just formed today, that it is a human being you removed, because that baby has become a full-blown child already. So let's follow the Catholic Church. So when the egg and the sperm meet, they are no longer egg and sperm. It is now something else. That thing that forms is like an egg, the normal egg you have, with a shell around it. We'll call it zona pellucida. And when you peel off the back of that egg will now begin to roll and roll and roll, journeying to the womb. It's usually about a 3 to 4 days journey, sometimes 5 days. But wherever it stops, it will plant there. Planting means it will start burrowing, like a farmer who digs the earth to put the seeds and to cover it. So it begins to bore a hole into anywhere it lands on that day and plant there. That burrowing process will cause that there will be trickles of blood that will be released. And this is what is called spotting. So it will look like you had your period, but that is a baby already looking for a home to stay. And because it oftentimes coincides with the date you're expecting your period. You may even think you are having your period, but maybe this month's period was not serious. Like in Gina's story that we read, that was what happened to her, right? And eventually she started treating malaria and lost the child. But sometimes this implantation, this burrowing, may not happen in the womb. It will go and happen anywhere else and plant there. So just so you know, if you're listening, I've already talked about spotting, or we may not talk about it again because we have a lot of other things to talk about. So this is what is called spotting. It is that baby looking for a home. When you just imagine if you take a knife and start piercing your hand, blood will pour out. And that's what happens when the baby begins to implant in the womb. All right, so that is spotting. That woman is already pregnant. So whenever you see light period that is not regular, it didn't happen 2 to 3 days like the normal one you used to have, you need to suspect, especially if you are sexually active, not in the dream, like physically. Okay. All right. I just said that to get you to laugh. All right. So now, if this implantation happens anywhere else outside the womb, that is what you call ectopic pregnancy. Why? Because I told you, once that egg removes the skin, that skin is just like if you crack an egg and peel it off. It is now smooth. It can begin to roll easily. So anywhere it finds itself, this is a primitive intelligence coded by God for it to end up in the womb. But if somehow the journey did not go well and it plants somewhere else, it will result to ectopic pregnancy. So, and that's the question I want doctor to talk to us about. So doctor, can you just briefly, because I want us to wrap up because we've taken a lot of time and then we'll have several other questions coming. Explain ectopic pregnancy to someone who is listening to us now in a way they will never forget it again.
Okay, thank you very much, Dr. Obo. Ectopic pregnancy, like you rightly said, is when the pregnancy implants outside the womb. Okay, normally it's the womb, the uterus that carries a baby. But then when the pregnancy implants outside of this womb, that is what we call ectopic pregnancy. Now, this implantation can be in the tubes, that are joined to the womb. It could be in the ovary. It could be in the cervix. It could be in the abdomen. Okay, so because the space usually where this abnormal pregnancy goes to is not as wide as the womb, as pregnancy grows, the womb keep growing. It's usually in a narrower space or a more confined space. This pregnancy is usually dangerous because it can lead to rupture of the tubes. It can lead to, and then when that rupture happens, it can lead to severe bleeding. The woman loses a lot of blood. It could happen internally, and the woman may not know, but she'll have signs, dizziness, and all of that. So it's a dangerous pregnancy and one that should be detected early enough so that this woman will not die in the course of the abnormal pregnancy. Okay, and there are subtle signs sometimes that you see. Okay, first of all, the woman notices she has missed her period, just like in the normal pregnancy. But then she'll start complaining. Oh, I notice occasional pain in my abdomen or in the lower pelvic
Yes.
region. Or I'm having spotting or bleeding. It's not as heavy as, okay, miscarriage, but there is bleeding coming from the vagina. Sometimes I feel dizzy, faint. Is this normal? So it may be that the ectopic is already leaking blood, before it comes out. So it's a very dangerous condition, having an ectopic pregnancy. And the fact that somebody has had ectopic pregnancy before doesn't mean that you can't have it again. So yeah,
That's it. That's it.
it.
This thing you said now is very important because we have a story about a woman who had, we're going to talk about it in this episode, maybe sometime in the future. A woman who had, she was raped when she was 16 years old, and then she couldn't tell anyone, so she hid it. Unknown to her, she got pregnant. Then one day in the middle of the night, bleeding and having very intense flank pain on the right, her parents rushed her to the hospital thinking it's appendix. But clearly to the doctor, appendix cannot be causing blood to be flowing from the vagina. They got into the theater and she had a ruptured right ectopic pregnancy on the fallopian tube. And then it was operated on. Years later, she gets married and then has another ectopic pregnancy. This time around, she got pregnant. She didn't go to the hospital for antenatal. She went to a maternity home. Then around 7, 8 weeks, in the maternity home, nobody asked for ultrasound. Nobody did a blood test. They just did a urine, established she was pregnant, and continued giving her care. Around the 8th week, she had a ruptured ectopic pregnancy on the left. So now the right tube is gone, the left tube is gone. And it is there in the hospital as we're managing the case that the husband is getting to learn about the right one for the very first time. The insight he had was that it was appendix. And so I'm just trying to say that, like what you mentioned, it's extremely important to know that for someone who have had, in fact, having had a previous ectopic pregnancy isn't a risk factor for another one. Let me continue on what you shared, Doctor, so that people can see some pictures to what you demonstrated earlier about ectopic pregnancy. So this is the fallopian tube, or rather, this is the woman's reproductive tract. So I don't know, Doctor, can you see my cursor?
I see your cursor, yes.
Okay, good. So I'm on this small one now because this bigger one, they moved it to the right so that they could draw attention to the emphasis on this side. So now this is the entrance into the woman's body. Now the sperm comes here, and ideally, this is the fallopian tube. On this side, this is another fallopian tube on this side. Now the egg will come from here. This is where the ovary is. It's somewhere around here. So these hands here will keep doing like this, looking for egg. It will just keep touching it. Keep touching it. Then any day it touches it successfully and sees an egg, it will pick it. That is the day that woman ovulated, correct? So if it picked it, it will push it inside, suck it in. So once it sucks it in, it starts moving like this and coming this way. And the woman will have a period, right? Or if it sucks it and gets in here, and a sperm is already coming up and meets the egg, what happens? They fertilize. Once they fertilize on this fallopian tube here, they will continue to journey all the way down into the womb and then plant inside the womb. But now let me explain what is now ectopic in pictures with everything doctor already said. So if you come here, you see that this baby is planted inside the womb. This is the womb. So if the sex happens from here, the egg sperm is released, it comes in, and then the egg and the sperm, they meet somewhere here. They continue to journey, and then they plant inside here. And then the normal pregnancy is happening. The baby will start growing. But if for any reason, the journey stopped here, like I told you, it will plant anywhere. It will pierce through anything it sees and deposit. If it pierces through here, right, it will be an ectopic pregnancy in the infundibula. 5% of all ectopic pregnancies happen here. If it comes down and even go and implant in the ovary, it will be an ovarian ectopic situation. Likewise, what you see here, which is the ampulla, this is where most ectopic pregnancies will happen. Or let's say you continue to journey and journey and journey and got here and did not progress and plant here, it will be at the isthmus. Or it went into the interstitium of the uterus or the womb, it will plant here. Or it came here and planted at the peritoneum or at the cervical place. So it can plant here, it can plant here, any of these places with a red marker pointing, these are all ectopic situations. This is the only safe one. And there are many things that result to this, but it is not because I have a lawyer, I don't need to know so much about the law. Because I have an engineer, I don't need to know so much about engineering. All I need to do is when I need an engineering job, I will consult the service of professionals. So in the same way, this lecture is not to teach you so much about medicine. This is just to give you enough information that you can live with. If a woman, let me stop sharing so that I can get to this thing and full screen. If a woman is pregnant, she cannot say it's ectopic or not ectopic. When she does the urine test, doctor, right, it will be positive. If she does blood test, it will be positive. Though the urine test may not show whether it is ectopic or not ectopic. The blood test, oh, give me a sec. My battery is not plugged.
Oh, sorry about that.
Yeah, let me work on that. Okay, good. The blood test will show some abnormal high readings of the HCG and other component that is investigated. And that way, you start suspecting that this baby is not planted properly. But the only thing that will give you a picture and you see with your eyes is ultrasound. So, doctor, can you talk a little on why it is important for women to go for antenatal in the correct place, where some of these things are done routinely so that they don't become victims of this avoidable circumstance? because this is one of also the causes of maternal mortality.
Yeah, thank you very much for highlighting this point. Ectopic pregnancy, like I said earlier, is a dangerous situation. Like, it's a ticking time bomb. It's something that can make a woman suddenly collapse, and if care is not given immediately, that woman can die from this condition. And many women in, reproductive years haven't even heard of ectopic pregnancy. They're not even aware that there's something called ectopic pregnancy. So it's important when you get pregnant to book in a hospital where they can do ultrasound, and not just anybody doing the ultrasound, because you require some skills to be able to diagnose this, so that they can know where exactly is this pregnancy. Is it in the womb? Is it outside the womb? Particularly if you've had ectopic before, you're like, you have almost 10 times the risk of having it again. So it's very important early in pregnancy, not the usual time our women come to book when it's already, 16 weeks, 20 weeks. No, the ectopic, the complications that happen most times happen within the first 13 weeks of pregnancy. So it's important that you do ultrasound that time so that you can detect it before it ruptures and it can be handled, So ultrasound is also important, not just in finding the location, because sometimes you may even have one pregnancy in the womb and another one that is ectopic, which we call heterotopic pregnancy.
Yes.
So ultrasound is very important. And also to know how many babies, and calculate the accurate dates for you. For women, especially that have irregular menses. So ectopic is dangerous. If you know someone that's had ectopic, you know that it's a matter of life and death. It's not something to be played with. So please, it's important to do your ultrasound, particularly if you've had surgeries and if you've had ectopic before.
Amazing. So just to buttress on that and we move forward is the fact that, like you mentioned, doctor, oftentimes when women have had a first pregnancy before, they tell you that I was my coach here. Right? That's Igbo language. They tell you I am non-experienced. So when next they get pregnant, you see that they don't have that humility. That's a word for it, to subject themselves to routine. They tell themselves, I already know what to do. It's not routine drugs. It's not calcium. It's not fesolate. It's not this. They just go and buy it and just start taking. And then they tell you that in 20th week, I will go. When my stomachs are coming out very well, I will go. The beautiful thing about, anyway, let's not get into that because this is a chapter in the book we're going to discuss extensively. So we'll stay on track. But just so you know, this is one of the reasons why people get drawn away into complex situations, because when it ruptures, the rate of bleeding can be so severe that before the woman moves from the house to the hospital, she's dead just because of the loss of blood. So it's not, I like the word you used, and it's every textbook mentions that it's a ticking time bomb. It's just a matter of when will I blow, but as for blowing, it will blow unless an intervention is done to detonate it. All right, so please, when you get pregnant in the future, or you know your sister who is pregnant right now, or you yourself, you are pregnant watching this, the moment you know you've missed your period, that is the best period to go to report. Remember, in the picture I showed you, 80% of the ectopic pregnancies happen on the fallopian tube, and the rupture is within 7 to 8 weeks. So it doesn't even give you the chance to wait to 13 weeks. So always go early. Let's get to the second thing that happens when people are pregnant. They begin to feel sick. They begin to feel sick, and some people I think I'm having typhoid, I'm having malaria, and then they start taking treatment. This is where we started the conversation, and this is where we're ending it. We've already talked about it. If you are just joining, at the end of the video, get back to the beginning and watch it. We've talked about it extensively. I just want us to talk about what are those medications, those ACT, we want to say ACT drugs, malaria drugs, what are they? Let me just give you a little highlight so those who are just joining late will not be completely thrown out of balance. We've said that when you take certain medications in the first trimester, in the early weeks of pregnancy, it can knock off the baby from the womb. And not just only medications, even herbal concussions. The worst thing about herbal concussions is that some of them may never knock off the baby. It will just lead to permanent brain defect in the child. The baby will be born with brain defects. I mean, nobody wants such a child, simply because of your lack of information. So let's not even talk about herbal concussion at all. Just throw it away, okay? And I'm not here to say that our ancestors did not do well. But what I'm saying is that you and I, as we are becoming the billionaires that we're going to be, we're going to invest money in researching our herbal medications, because it takes money to research these things, to isolate the chemical component in those drugs. Your bubonise may contain 10 different chemicals, one that cures malaria, one that even now gives malaria, one that brings HIV, one that cures HIV, that's why they tell you this one cures everything. It's dangerous. Your dogoyaro, all those mixtures. The funny part is that they don't even give one. They will bring this leaf, bring the other leaf, mix everything up, and it makes that you don't even know what is working in that particular medication. But the medicines we prescribe for you have been studied, distilled, the specific thing working have been isolated, the dosages have been studied, their mechanism of actions have been studied, how they're cleared out of the body has been studied, so that you don't poison yourself, or so that you don't also resort to abuse. So one of those medications that knock off babies, according to research, is ACTs in the first trimester, especially when they are given without a doctor's view, when a woman just goes and just takes them recklessly. So I want to talk about what is an ACT drug, doctor, and what are the common examples?
Okay. So ACT drugs is a artemisinin-based combination therapy. It usually combines at least 2 drugs. Okay. So an artemisinin drug, and then another component that makes the effect of the artemisinin to last longer. There are common drugs that we use in treatment of malaria. Well, currently, we use them in the first trimester if there are no other options available. If a woman accidentally takes these drugs in first trimester, there's no need to terminate that pregnancy.
Yes.
Okay. But we use it more safely in the second and third trimester. Now, yes, example of these drugs, I'm not going to list brand names. I'm going to call the components of the drug. Okay. So something like artemether-lumefantrine, that's the most widely used ACT combination. Okay. So there's also artesunate amodiaquine, artesunate methylquine, dihydroartemisinin piperoquine. Okay, so but just know that most of the anti-malaria drugs now we use, the ones you take one in the morning, one in the night for 3 days, those are the ACT drugs. Most of them are yellow color. All right, so I'm going to skip brand names. Thank you.
Thank you so much. So I'm going to drop all these combinations she mentioned in the comment section. So the mefloquine, the artemether, the dihydroartemisinin, all those combinations, I'm going to list them in the comments, because I know some of you sounding like someone is speaking in tongues, all right? Because it's not your field, so the language and all. I'm going to drop it there. So those are those medications, and they are very effective in treatment of malaria, and that's why they are used. Every time you go to buy any of those malaria drugs, you see them written ACT on it. ACT will be written on it. All of them, they'll have ACT written on it. It is the current standard for treating, let's say, mostly uncomplicated malarias, which is most of the malarias will have all the time around us. Okay, so apart from these medications, doctor, are there other medications? Let me not even talk about herbal concussions, right? Let's put that aside, okay? Are there other medications or other things that people should also be careful about in early pregnancy?
Okay, yeah. You see, the first 9 weeks of pregnancy, we even extend it to the first trimester, that's the first 13 weeks. It's a very critical period in pregnancy. That is when the baby forms. By the time you do a scan at 13 weeks, you see that the baby has formed completely. Okay, so this is the time where the baby is mostly at risk of different toxins, whether drugs, chemicals, or anything that can affect the baby. So women need to be very careful during the first 13 weeks and also throughout the pregnancy, but the critical period is that first 13 weeks. All right. So usually we do what we call preconception care. Okay, but we found that our women don't usually come to the hospital before they conceive. But if you're in the developed countries, they do, because you need to screen these women for so many things. Some people are already taking drugs before they take it. So that's the time for your doctor to look at your drugs. Okay, you're taking antihypertensives, for example. That's the time to say, okay, we need to switch from this to this. Or you're taking anticonvulsants, for example, say, oh no, this one is more likely to harm your baby. We need to switch from this to this. So sometimes when we talk about the harmful drugs, people think it's from the moon, but they are common drugs that we take every day. So the antihypertensive, the ones we call the ACE inhibitors, the captopril, lisinopril, enalapril, all those ones are not safe in pregnancy. Also, the angiotensin receptor blockers. Okay. Then sometimes you'll have a woman struggling with acne, pimple, and all of that. She's using retinol, isotretinoin and co. High doses of that is not safe. Okay. Vitamin A, high doses of vitamin A, even ibuprofen, you're having occasional aches here and there, and then you're casually buying ibuprofen off the counter. They are not safe. So please, this will be an opportunity to encourage our women to go for preconception care, not just for drugs, but also to check your overall health. Make sure that you're within the normal BMI, your weight is okay, to make sure that your BP, if you're having blood pressure, is even within the safe limits where you can take in, to check your blood sugar and so many other things, So yeah, that's about that for the drugs. And please, how about medications? I don't know. Doctor, have you done any studies? I don't know any beneficial effects right now of herbal medication. So please, if you're taking that, kindly stop. It's not helping your fertility or anything. Okay? Thank you.
Amazing. Thank you so much. I'm happy with the way this conversation just switched. And let me explain what I mean. All right. Okay. Chapter 3 of this book, what we're going to be discussing next week, is preconception care.
Oh.
You see what I told you? Like, the book is a journey. It's very intentional. It's a flow. After this is next. After this is next. Because like you said, most people don't understand the state of their health before they get pregnant will affect the outcome of that pregnancy. Now, if some people, not even because they're taking BP drugs, some may not even be taking at all, and that's even the problem, because they already have high blood pressure and they now get into pregnancy with high blood pressure. Some may even need to take medications for a period of time, stabilize their blood pressure before they get into pregnancy, and all of those complex issues. Because let me not get ahead of myself, because this is next week's topic. It's going to be so exciting. Like, in fact, for those of you who are listening, there are circumstances we see in women and we'll tell them, please, don't be pregnant for life. Because we always weigh outcome and we'll check what is the best decision, right? So next week, that is what we're going to be looking into extensively. In addition to everything Doc have said, I just want to add that you want to make sure that you avoid alcohol, all right? So You want to avoid social drugs if you are used to things like that, because those things are not healthy for the baby, especially in those first 13 weeks where everything about them is developing. Their brain is developing. Their muscles are, their cartilages are developing. Their bones are developing. Everything is just forming. The first 13 weeks is when the child forms. After it forms, the second trimester, it begins to now develop. So whatever it has formed already, if it has formed and become a bad brain, it will just develop into a bigger bad brain. If it has formed to become bad bones, it will just evolve to become bigger bad bones. That's why this first trimester is extremely, extremely important. All right, I think we've come to the end of the conversation. But before you go, Doctor, I want us to get to the question we asked earlier. So you have a friend, and then the friend got married on the 22nd of December, had her period starting on 29th, and she calls you on the 29th and say, hey, Chioma, hey, David, hey, Kunle, hey, whoever is on the call. See, do you see, I'm even calling guys' names, right? Most of the people on this call are ladies. And then they call you and they be like, please, I want to make sure I get pregnant immediately I get married. My period just started today. Today is 29th of December. And I know my cycle length is 29 days. When do you think I will ovulate? When should I start having sex? So this is the answer. So her period starts on the 29th of December. December has 31 days, all things being equal, right? All things being equal. So we're going to count 30th and 31st, 2 days. Remember we said her cycle length minus 14, correct? So her cycle length is 29 days. 29 minus 14 equals to what? 15 days. What does it mean? If she starts seeing her period today, in 15 days' time, she will ovulate. So since she started seeing her period on the 29th, let's count 15 days. 15 days is going to be 30th, 31, 32, 33, 34, 35, sorry. 30th, 31,
29.
first, second, sorry, I'm mixing it up. 29th.
We're starting from 29, yeah.
29th, 30th, 31st. First, second, third, fourth, fifth, sixth, seventh, 8th, 9th, 10th, 11th, 12th. On January 12th, your friend will most likely ovulate. So what is your advice to her? She should start having sex 5 days before that ovulation, which is 7th of January, and continue to have sex 3 days after ovulation, which is 14th, correct? Which is 15th of January. So her ovulation is January 12th. Yeah. And then her fertile window is 7th of January, and then till 15th of January. Okay, we're going to take more questions right now. We're going to pause the video. We'll go to the comment section. Every question we've not been able to take, you're going to begin to drop it right now. I and Doctor, we're going to be in the comment section and be answering every single question that we're able to do. We're going to do that for the next 20 minutes. So if you have questions, begin to drop them right now. And secondly, if you want to join our community so that you'll be getting the links to free videos, health talks, ask questions, many doctors from the 36 states and the FCT are present to help you free of charge health information. We're going to drop the link in the comment section. Also join that place. If you also want to volunteer to help us to spread this news to communities around you, you make posts about it, share, tell more people about it. We're also going to drop the link. Next week, by the same time, by 7 p.m., we're going to be live here on YouTube for the Family Health episode 3. And we're going to be looking into the topic that says, give me a sec, let me open the book. Well, we're literally reading this book. That's what we're doing, all right? We're literally reading the book. We're going to be looking in the chapter that says, get healthy before you get pregnant. And that's the title of that chapter. And this is a woman, her name is Kate. She shares her story in this book. Her story is a very sad one, very, very, very sad one. But we're not trying to build on people's sadness, but we want to share more knowledge so that other people will not have sad experiences. Dr. Odigonma, I don't know how I can thank you for being on this call. Thank you so much. We're going to just pause the video now, just shut it so our eyes can get rested. And then let's begin to answer all the questions. And thank you so much. The next time I'm in the East, I'll make sure I come around Nayut, and then I'll see some doctors that are trying, because I know the best doctors are from Ebonyi State University Teaching Hospital, but I know you don't agree.
Yeah. Thank you very much, Dr. Obo. You're doing a wonderful job for women. This is something that we've needed quite a while, to educate the public, to initiate these conversations and let women know the importance of some of these discussions. So thank you very much. Thank you for the passion and love you put into writing the book. I can't wait to have a copy. I'm sure it's very well written. So thank you very much. Well done.
Thank you, and thank you. All right, guys, see you in the chat room, and let's begin to ask. Okay, I'm already seeing some questions, and let's get to them. Fingers crossed. Doctor, any question you answer, you're going to put hashtag Dr. Odigonma, so they'll know it's from you, all right? So that they won't say it's Dr. Ovo that said this. They'll know it is especially from you. Then the ones I answer, any of those difficult questions, I'll make sure I just tag you and be like, hey, please come and answer this question here.